The business at the end of the day is the people that you have in the business that that run and operate the business. So it's about making sure that you've got passionate people who believe in the vision, understand where it's going, and can operate to the best of their ability.
Dr. Julian Nesbitt of Dr. Julian. If you've got feedback loops taking place both from the customers and the clinicians that you've got on board, how do you balance those two key bits of feedback, and who gets priority, and how do you determine which things take priority?
Interesting question. Well, it depends on...
Welcome to Founder Metrics by Vested, the podcast where we dive into the world of hotshot business leaders and the metrics that drive their game-changing companies forward. I'm your host, Ifti Nasser, CEO and founder of Vested.
Hi, I'm Ifti, and this is Founder Metrics. Today, we've got Dr. Julian Nesbitt of Dr. Julian here with us today to talk about the important metrics that helped him steer and gauge his business. So, Julian, over to you.
No, well, thank you very much for having me here. So, so I'm Julian Nesbitt. I'm a doctor by background. I was actually an A&E doctor when I came up with the idea. I'm now working still as a GP a day a week. So in terms of the business that we've created, there was a huge problem that we saw in terms of access to mental health care. And I think we all know the problem that's getting worse on a global scale, actually. Waiting lists are just getting longer, and we know that sort of clinicians are getting very burnt out and leaving. So what could we... I just thought we could try and come up with a solution to this problem, and looking at things like the banking sector and other sectors, with Uber, etc. The NHS and healthcare in general is not utilising technology to the same effect that some of these other sectors are. So I thought, why aren't we utilising a technology platform that kind of benefits the patients, benefits the clinicians, and automates the admin and does things? And I thought initially, in terms of connecting you with a clinician, with a therapist, if you could utilise a tech platform and do it online, then you could utilise even a global network, or at least a national network of clinicians, and then match people to the right clinician for them.
Yeah, that's brilliant. But given that your training was as a doctor, what gave you the notion that you could actually build a tech business, essentially, leveraging tech to do this?
Well, you can't do it on your own. For a start, you've got to understand your weaknesses and, I guess, build a team around you. Although, having said that, the first few years I worked still as a full-time doctor, sort of, potentially having kind of bootstrapped the business, and not really knowing what I was doing. It's a case of going for it and building it. And if you think it's a problem, and I had a huge passion for this problem that I think needed solving, you just have to go through the steps, go through the motions, start with a product that doesn't work very well, which it doesn't initially. So long as you're providing clinical safety, that's obviously important. But from a tech perspective, apologise to the patients, say we're building a platform, but we will provide you with the best care from our clinical perspective, and then you just keep building and building and building, and that's how we've got, and how we got there essentially.
So how did you get your first client?
So in terms of getting the first client, initially we sort of said, okay, could we build an app again just to connect patients to clinicians, and we launched that into the private sector. But interestingly, to do that, you do need a lot of marketing spend to sort of market that product out. And I think I was also almost sort of more passionate as well to try and provide this to the NHS, and as an NHS as a free service, and also obviously in the corporate space where they can pay for that as well for the patients coming in or the service users coming in. So I think, from a perspective of getting our first client, we knocked on a few doors in the NHS and realised, they are really, really struggling to meet their targets. As I was saying, in terms of the problem, like these patients are waiting on waiting lists 9, 12 months, sometimes even up to 2 years. So by having a system where we could recruit clinicians in a more efficient manner and match them and give patients choice, etc., they were like, actually, can we use your service? And actually, by utilizing the technology and doing it online, it was also cheaper for them. So we were able to provide almost a better service at a cheaper cost.
So you didn't have to do too much marketing. So I mean, there's piece of business like this, you would imagine, NHS is a bit of a dinosaur.
Yeah,
is it?
absolutely.
I mean, that's an assertion, not a statement. But how do you getting past go with one? I guess helps you with the others. So how did that actually happen then?
Yeah, so I mean, so with the NHS, it's a very slow-moving beast, and you can't go too quickly with it or change things too radically where change is not necessary. I think what we found with the NHS was, guys, we can help you with your waiting lists initially, and they have targets to meet for those waiting lists, so they were desperate for that help, and therefore we could provide that option. And obviously, starting doing that from a slow basis and building that up, we then started to prove that we can get good outcomes, very good satisfaction from the patients and from the clinicians, and actually doing it at a more reasonable price that would normally cost, because we can utilize the technology to create efficiencies. So yeah, it's.
How do you measure the success of the platform in terms of usage? Is it the number of trusts that you're being used at? Is it the number of patients using it? How do you measure?
So there's a few measurements. So obviously the number of users coming on, the number of patients, I guess, is the biggest
ultimate,
the biggest one, because it's obviously then the number of appointments that you're doing, and if you're if the way that your business runs, which is how ours is running from that side of the business, in terms of you're making money on the appointments. So obviously it's the number of appointments that are being done. There are then obviously other metrics in terms of how many organizations, trusts, or corporates, etc., that are using or referring into you. And obviously, some of the mistakes that other providers I've seen happen is where they've had one client that's sort of 90% of their user base, and if that client leaves, you've got a problem. So we've tried to spread that out. So we're now providing services to 33 or so NHS trusts with
33.
More, yeah. So and more coming in, as well as occupational health services, looking at health insurers as well.
How many are there in total?
NHS trusts. Well, it's a complex. There's about 120, but again, it depends on how you categorize it. And what's happening with the NHS is there's sort of clinical commissioning groups for various areas that are now becoming what's called integrated care boards. So they're trying to amalgamate things together. So it does depend on how you measure it. So there's
based on the current measure,
yeah,
you've probably got about a quarter of them already signed up and using the platform.
So yeah, potentially, and there's sort of again, it's also the number of services within that area as well. So yeah, I mean, it's been successful through word of mouth, really. Good. So I think with the NHS as well, you can't actually sell to them. I don't think it's not a very good idea to try and sell to them. What you do is...
Why not? We had the chat about this earlier on, and you were saying how difficult selling to the NHS is. Yeah. Firstly, why? And then how?
So people in the NHS, and as a doctor, I don't like being sold to, right? So if a pharmaceutical company comes and says, you need to use my drug, I'm trying to that you just switch off, essentially. So that doesn't work. What does work is saying, you obviously have to get your first break with that first client, and then you can use that as a case study, and you have to be making sure that you've got strong evidence behind you that it's working. And I think the biggest problem with the biggest thing with the NHS now is we need to save money. So we need to find more efficient ways of doing things. And if you can go to an organisation or a trust that say, we are able to provide this service that you need to provide at a more convenient way, mainly at a cheaper cost, and help you to meet your targets, then you don't even have to sell it. It's just that's what they need to happen. And I think
So did being a doctor? I'm guessing that being a doctor helped. So did it? And then secondly, was your own trust the first trust to use it?
Yeah, interestingly, my trust wasn't, no, but I think it must help. I mean, obviously it's trying to understand the mindset so that you can, and you can kind of come at it from the inside to say, I've seen a problem, I'm trying to help, why don't you pilot this? Let's try it out. So I think obviously that obviously helps. I think having got it off the ground, I think some of the problems that people have with selling to the NHS is you might have a wonderful new technology, but if someone hasn't got the time to adopt it, or it's not in their immediate priority list, then it's not going to get adopted. So for me, it was about solving an urgent need that needed to be solved, and then slowly introducing technology in a more efficient, better way. And now our platform has sort of been built over 6 years or so. People are coming to us to say, can we use your technology as well for our own service? So we started licensing the platform as well as us providing our own service on it.
Brilliant. I guess to start off with, you mentioned about bootstrapping.
Yeah.
What did you need to get, or to get to where you are now? Have you taken investment? Where are you on that journey?
Yeah, so we've taken bits of investment along the way. So we haven't followed the typical funding course, and I guess having been a first-time founder, you don't know what you're doing at the beginning. You have to learn by going through it and
lots of learning,
understanding what's going on. I had an initial small investment. Obviously, I didn't take any salary or anything. I was working full time as well. And to help build out the tech, you have to take a small investment, and then trying to do things as efficiently and cheaply as possible, and then so we've taken a few investments along the way, yes, and we're now got quite a lot of interest for a slightly larger investment, which is going to help propel our technology side, where we're sort of selling our platform as such to other service providers as well.
So when you think about those early investors, what were the metrics or things that they were looking at to make that investment, and how, if at all, are they different for the prospective investors that you're talking to now?
Yeah, so I think normally what happens is you sort of do a friends and family round where they sort of believe in you and they give you a little bit of money to give it a go, and that's based on sort of vision and trying to articulate the problem. And then once you sort of get going, you would then do normally an angel type round. Again, the country has good tax breaks and things, so it makes it easier for them to want to invest. So in terms of that, it's about various metrics. So what's the growth? I think having had NHS adoption, that was a positive sign, and showing that we've been growing at about 240% year on year with limited funding. I think again that's a positive sign for them. And again, at that stage, it's also again believing about the problem and what your solution can it fix it as such.
So when you talk about growth, 280% year on year, was that 240? Was that about the number of users, or was it about the revenues that were coming through? What was the growth? Yeah,
so that's based on revenue. Obviously, users are linked to that depending on how the business functions from that perspective. But yeah, as I say, we can talk about other metrics that isn't just revenue, because obviously it's important to see where it's going in terms of some other metrics. So
I think you're right, because whenever you're looking at investors, I guess revenue is a big one. But as a business leader, there are probably other things that you're looking at to help you know the health of the business and where it is. And what are they for you?
I mean, and this modern climate as well. I mean, there was an attitude previously where it was growth at all costs, and it doesn't matter how much money you're losing. And now we've seen a number of companies, unfortunately, go by the wayside from that sort of approach. I think if the business, I think you have to have a pathway to profitability. I think the fact that we basically bootstrapped it, so we try to keep our costs quite low, so we weren't burning a huge amount of money, which I think is helpful, and showing a pathway to profitability of where the business is going, and actually this is what it's going to take. You do need investment to get there, especially with a technology platform, but I think that's important. So what's your burn rate? Is there a pathway to profitability? And then you've got all the other metrics in terms of how is the business performing? Will it? So for us, it's around what is our feedback? What is the evidence of how it's working, so that we can get better adoption? What is from one side of the business where we're providing the clinical services? Clinicians have a wide variety of places they could go and work. So why would they want to come and work for you? What's your retention rate of those clinicians? How many clinicians are you able to onboard? And then obviously keep. And there's no point onboarding 50 and losing 60. So you have to.
So if one of the things is about how you attract those clinicians, they're going to be looking at stuff. What are the metrics, for want of a better phrase, that those clinicians are looking at when they're assessing Dr. Julian versus any of the other either platforms or activities that they can get engaged in? What is it that you were communicating to them in yourself, for want of a better phrase?
Yeah, so I think, well, firstly, we wanted to have a technology that helps the clinician, right? And as I said, we know that clinicians are getting seriously burnt out and leaving. And I think that the current systems that we're using aren't necessarily fit for purpose. They were built a while ago, they're not built on modern technology, and they don't necessarily give the clinicians the user friendliness / the automation of admin, etc. that could be used. So if we could build a platform that really helps and supports them and makes their life as easy as possible, that would be one thing in terms of the technology of building. Obviously, money is a factor. So if you're paying someone half the price with somewhere else, then they would obviously be
less inclined.
That's a big factor. But again, you don't want to be at a race to the bottom to sort of keep going, because then again that would cut into your margin, etc. And then I guess it's also about a community feel and do they believe in your vision and what you're trying to build, and
how do you measure that community feel? Is there any tools or
that? I mean, that's a reasonably hard thing to measure. However, we have surveys that would go out asking what would they like more of, etc. I mean, we sort of do various things like run yoga classes and those sorts of things to try and help. Some people don't want that at all, others do, so it's based on the choice of what they would want. And I think the biggest factor would be what's your retention rate, and how many people are you onboarding. And I think we've been pretty good on that not many have left, and we would phone individual therapists. We have someone that specifically does that to find out why. And most of the time it's then moving on for various reasons.
And have you been able to take that information so I think that's absolutely important, being able to understand why people are leaving a platform is as important, if not more important, than the people who are joining.
100%.
So you take that information and you get hold of it personally as Dr. Julian, the human, on behalf of Dr. Julian, the business.
Yeah, no, I say I used, so when you start, I kind of phone everyone individually, and therefore they would give you some slack, etc. And then, we actually have a specific employee that does that task. So again, we're continually we've got a very good people-centric organization. HR function, recruitment function, where we're constantly trying to improve things, constantly trying to learn, and basically work out what is needed or why are people leaving. I mean, you're never going to stop everyone leaving. Some people go off and have children and other things. So but you can try and do the best you can and just I think the biggest thing in business, from my perspective, especially in a sort of scale up now, is constantly iterating it, learning from feedback.
And going to the people, you, like Vested, are a fully remote business. So when you're looking to understand how your people are feeling, because when they're remote, you don't get that human interaction on a daily basis in the same way as you do if everybody's in an office. So how do you measure and gauge that for the health of your business?
Yeah, absolutely. So I think, so we kind of, we grew up as a business, I guess, through COVID, but obviously it's been remote from the start. And I think the fact that we were a remote therapy organization, so it was sort of ingrained in what we were doing. It depends on the person that wants to work for you. Now, certain times I think you do need to get together, and I think that is very important. But the majority of the time, I think you can do it remotely. There are new tools out there now that have grown up through COVID that help with that. Obviously, things like Microsoft Teams and others, that you can have channels and you can arrange meetings and you can do things. I think you've got to empower your individual heads of department, etc., to be able to run their team how they want to. And as I say, like, you could then do community things like the yoga class or etc. to sort of build a bit of that culture in. We have had feedback that staff that want to join us because it's remote, and therefore you can actually hire people from all over the place. And
so how many have you got?
Talent.
Have you hired now? How big is the team?
Well, in our sort of head office
In your
full-time staff.
The core team.
I think I think we're up to 44, 45 now. So yeah,
brilliant.
But yes, we're sort of scaling up as you say. So.
And where do you see that in the next year or so?
Gosh, that depends. I think where we're growing quite nicely and very and organically on our service model side. As I say, we're onboarding new organisations all the time, and therapists and clinicians, and we're starting up new services, such as a children's service, because that again is a huge problem. Children are not getting access to mental health support, so wanted to try and address that. And obviously that side of the business will grow, but we've also now got this other side of the business, which is where we are licensing our technology platform for other service providers to benefit from the sort of end-to-end case management, care pathway, electronic healthcare record systems. So it does depend on a few factors, but and it does depend on the funding that we get to how fast we can grow. But obviously that technology side will be growing quite rapidly. I expect over the next 6 months to a year.
And in terms of the funding, as you say, will you be getting much from the NHS as well? And how does that balance out with the private investment or third-party investment that you'd be looking for?
Yeah, so the NHS doesn't sort of fund us as a business per se, but they would pay us for the services that we provide them.
Yeah, but do they contract
yes.
for those services, so you know that you're going to get a certain amount, so that's bankable as a metric?
Yeah, exactly. So you would have a contract with a trust or with a service in the NHS, and it would say, I'm going to send you this number of referrals per month. And then
you can bank on that, and then you can build based on that. And the other routes for revenue, I guess, are more to do with licensing rather than number of users, rather than number of patients coming through.
Yeah, as I say, so obviously the sort of service model side of the business will be number of appointments. There is then also, from the licensing model, would be utilization of the technology where you're not providing the service. So that would be licensing, what we call a SaaS model, software as a service. We're also doing some interesting things. We're building out, so from another perspective is you can get grants. So we were able to get actually a couple of grants to help to build out new technology as such. If anyone's building new things as well, there's also a government scheme where you can claim back some of the R&D as well on the end of that. So one of the things we're building now is, when people have therapy, you have to do homework. It's like when you go to a physio, you have to do your exercises at home. Pretty much very few people do their homework. Now, at the moment, why is that? Why is the engagement so low? Well, people have to get it sent on an email or a worksheet or whatever. They're just not motivated to do it. So what we're building with this grant is a digital versions of homework that have an AI assistant, which will help to motivate them, send messages, link back with the clinician, and do it in a user-friendly way.
They're following through on what's being suggested.
And then the AI can learn from what that person wants, or if, for instance, if going for a run in the morning is a positive thing, then it will learn from that and try and help you and support you. And then there's a way of sort of rewarding without punishing as well, that helps to motivate and around goal setting, etc. So I think having that sort of digital way of doing things, for me, we need to assess it and test it. We've got a patient population, obviously we can test that on, but these are the sort of things that you need to build out. And then obviously that could also be licensed. Those sorts of products that you build could also be licensed.
And Dr. Julian is focused initially on mental health support. Do you see the ability to go to broader medical support, and what might it go to? Yeah,
absolutely. It's like an evolving business over time. I think what we found already is when you look at the technology, it's very customizable and it's built in a modular fashion. So you can sort of pick and choose the modules and build new modules and customize it to however you want it to be. So it doesn't just have to be a therapist on that module. It could be whoever. It could even be a tutor, for instance. But we're sticking to the medical side. We have had approaches from organizations that want to use it across multiple care pathways, so potentially they're physios, dentists, etc. Even there's interest from international countries abroad where they're sort of just using paper and actually utilizing a more modern system that's more customizable could be across the whole of their healthcare system. So, you could, the sort of scalability is limitless based on the fact that so long as you're prioritizing things and making sure you're not trying to do everything all at once, but utilizing the tech in different use cases and then going for that.
So how are you going to assess when it's ready to go beyond? I mean, you've said that you've already had conversations.
Yeah.
What will let you know that it's time for you to broaden that horizon and actually deploy it against other problems?
Yeah, so it depends on the functionality of the platform and who wants to use it. Also, being careful that, for instance, if you're going to use it in a use case that will require a huge amount of development and potentially could be a big distraction, then you've got to learn how to say no as well and just prioritize and focus on what you're doing one at a time. But what we have found, so for instance, organization that provides therapy but also then provides other services, rather than utilizing 7-8 different platforms across that organization, they might want to, I think they want to consolidate it. Yeah. So therefore you can start to do it that way and start to, to build out the tech to allow them to consolidate it across their different services. And once you have a use case for that, you can then go to other services.
It actually sounds really exciting that, you just, although when I'd done my own research, it looked very appropriate for what you'd got it kicked off on. But yeah, now you talk about tutors, other healthcare, not even healthcare related services. It's got quite a lot of potential. But then when you look at the team behind it, I mean, you started off from a very strong ethical perspective, trying to solve the problem in the NHS. When you move away from that, are you going to still be as passionate about it? Because being a founder is not an easy gig, as you know.
No, absolutely. Well, you've got to build a team around you that can do the things that you're not good at. That's the point. And I think so long as I think it's important that the founder, I think if the founder's not involved or the ethical element goes away, then you lose credibility of the business. So from my perspective, we're building a business that is always going to be ethical and isn't just based on, obviously you need to make profit because that's what the investors and your shareholders expect of you, but you can do that ethically.
The investors and shareholders, it's if you want that idea
Correct.
or that proposition to continue to have a life, it has to be sustainable.
100%, yeah. And you want a very profitable business naturally, of course, but you can do that in an ethical, sustainable way that isn't, just focused at money at all costs. I think.
So have you already let go of opportunities on the back of that ethical dilemma in your own mind?
No, I don't think so at all. I don't think they're connected in that way. I think actually by being ethical, it actually creates more opportunity because people want to use you more. You get more therapists coming to join you. So actually from a perspective of being ethical, it's actually you're able to make more profit because you're ethical. I believe. And then I think as you say, moving away from it, I think by having the technology platform, actually by licensing it, you're able to allow more people to benefit from it. So therefore, you're actually expanding your reach further. Would be my.
So in terms of the success of the platform itself, you've got feedback loops taking place both from the customers and the clinicians that you've got on board.
Yeah.
How do you balance those two key bits of feedback, and who gets priority, and how do you determine which things take priority?
Yeah, interesting question. Well, it depends on where what are your immediate priorities in the business? Where are you going? Obviously, you want to be improving things all the time for both groups. I think, I mean, again, it's just a continual improvement in what you're trying to do. I think I don't think one could take priority over the other because they're the same. They're a balancing act because without the patients, you can't have the therapy. Without the therapist, you can't have the patients. So you kind of need to do both at the same time.
And what are the biggest challenges that you've seen from the patient perspective?
Yeah. Well, so there's a few, obviously, being an online business, not everyone in this country has access to the internet yet. There's still quite a lot of health inequalities there, etc.
So connectivity is one.
Connectivity.
I guess use of the internet, even if you have the connectivity, you might not want to.
Yeah.
But is that human element, how big a factor is that? How much are you seeing, firstly, people still reluctant or not wanting to go digital?
Yeah.
Versus...
Well, interestingly, when it was sort of set up, founded, there was a big thing to say you must see a therapist face to face. But there was a movement that was sort of going towards the fact that you could do it online. Now, I'm not saying that everybody should do it online. I think there needs to be choice. But I think what's interesting is since COVID, everyone has just realized that you can. I mean, in mental health especially, there are... you don't have to physically examine a patient like I would as a GP now, to listen to their chest or whatever. And what we find is by having it online, you can have a much wider selection of clinicians that you can help match people. So if they need someone that speaks a particular language or is a specialist in a particular area, you can help to match them with the right person there. You can give them choice. They can actually have the appointment at a more convenient time for them. So rather than saying, your appointment is in 2 years on a Tuesday at 8 a.m. in some random place that you don't know where that is, or you've got to go in there and park and you've got to do that. You can pick your appointment on the booking system and then have it from the comfort of your own home, in your slippers with your cup of tea. And actually, that opens up things. Now, obviously, not everyone has a safe space. In that case, you have to adapt around that. But I think the interesting thing is that we have had people that have, really, most people don't struggle, and you've got to make the system as user-friendly as possible. But those that may struggle to use the system, because you're offloading the admin of most of them, then you can still have telephone conversations with those that need the support.
It's interesting, just a previous conversation that I'd had, the role of the clinician. How do you, and you also already mentioned that you're using AI yourself, how do you see the future changing? Do you think you'll need as many clinicians?
The key question at the moment, right, with all this AI hype. So my philosophy is augmentation and not replacement. Now, we've already said that we don't have enough clinicians, and the waiting list is 9 months to 2 years. So actually, we need a solution to help augment that clinician. Now, I don't think that we're ready yet and I don't think we're going to be ready yet for a long time with mental health, especially now. Mental health, and we're human beings at the end of the day. We need to have the empathy. We need to understand the social circumstances, etc., that AI what doesn't have at the moment. Whether it is in 15, 20, 30 years' time, who knows? But I still think at the end of the day, we're human beings that need to relate to each other as human beings. So in mental health, that's especially important.
It sounds like it's even more relevant. You might almost think that mental health will be one of the last places that AI would take over.
I believe so, but what you can do is utilize AI for what it's good at. So automating processes, admin, reducing the amount of admin that a clinician needs to do, therefore being able to free up more clinical time for that clinician. And I think, that's where we're going with it. I mean, it's also potentially good at doing triages and assessments, etc. I think it's great potential, and we've got to embrace it and work out what its best use cases are to augment.
So the next opportunities for AI at Dr. Julian will be where? Where are you going to look to deploy it?
So the first thing is in our digital homework. So understanding what our users prefer to do, and it can help to then start to personalize that more for that user. I then think from the data that we collect, because we're collecting all the outcome measures and obviously analyzing all the recovery rates, etc., all the time, I think you could utilize AI to find out and help even match patients to what's the most appropriate clinician or course or self-help tools and resources that person needs, and then therefore the platform can even more personalize that care for that individual. I think that's
actually that's brilliant. The fact that from the information, the data that you collate, you can start iterating the service and the deployment of the clinicians accordingly.
Exactly, and even we've built out resource libraries as well. So if that because the person only sees the clinician for maybe 1 hour a week, therefore what are they going to do the rest of? So you've got digital homework, and then you've got personalization of the resources and tools that person could use in the platform, self-help tools, etc. throughout. So I think by understanding that individual through the data that you can collect about that individual, you could help to personalize it. Now, obviously, you have to be doing that ethically and with all the data principles, etc. But I think it's a very interesting time where we can help to individualize and personalize care. We have to get more preventative. We don't have enough clinicians, as I was saying, so we have to either we've got to make those clinicians more efficient, more powerful, but also we have to try and move more into prevention. And that's in healthcare in general. An aging population that we have. How are we? We've got a big problem there that's going to get worse with a hugely aging population.
Are there any different metrics or measures that you have in mind that you think other founders may not have noticed? Because obviously everybody knows about the general stuff, whether it's cash flow and profit, MRR, growth rates. Are there any metrics that you have seen or that you've used that have helped you as a founder that you think would be worth sharing with other people that are not those normal?
Yeah, I mean, you've got all the ones the VCs look at and cost per acquisition.
And let's assume that everybody knows those. So what about the ones that helped you? They're a bit different.
The human factors, I think, obviously important in a human-centric bit. Well, depending on which side of the business, but I think those are and employee retention and making sure that your employees are motivated, believe in your vision, and that those are the ones that are working well in the business. The business, at the end of the day, is the people that you have in the business that runs that run and operate the business. So it's about making sure that you've got passionate people who believe in the vision, understand where it's going, and can operate to the best of their ability, feel empowered, and employee retention
is a good one. But how do you what's the precursor to that? What have you been using polls, or how do you assess so that you don't have the people leaving? How do you manage that or mitigate for that?
Yeah, so we do regular sort of company surveys all the time, and again, it's around understanding who's happy, who's not happy, trying to, if they're not happy, why are they not happy? I think we've got a very, very good employee. It's interesting. We've got a very good employee retention rate. I think because they really believe in the purpose of the company as well that we're doing, and we're constantly trying to improve things, make, as I say, social events, etc. We're very inclusive, and I think it's it really shows. And everyone's, for instance, on our chats and our Teams channel, etc., all supporting one another. So I think that's and a great community, I think, is very important.
And you mentioned that there's that core bunch that are your key team. Above and beyond that, how many people do you have as associates or fellows, for want of a better phrase?
Yes, so so sort of a self-employed base. I think we're up to 230 odd clinicians now, but that's growing. That's growing all the time.
So the total team is close to 300.
Well, depending on
If you class them as part of your team, I mean, teams today are not the same. They're not. A team is not just a bunch of employees. There's all sorts of people part of the team. That's incredible.
So I mean, obviously, in terms of the so in terms of how we're operating our services, we have our full-time clinicians that work for us because they want to just be on a salary, etc. But for us to have that breadth and depth and be able to expand our services rapidly, you have the affiliate therapists who might give you between 5 to 20 sort of hours a week, and you can then place those in where they're appropriate to be placed to help run those additional
and that's
services.
part of the software that you've built allows you to do that deployment as well as
so a clinician might be we're working with these trusts. Some of them there's different services within, so you've got different types of therapy. For instance, you've got what's called step 3 CBT, or you've got EMDR for trauma, or you've got different counselling modalities that people use, so counselling for depression or interpersonal therapy, etc. And obviously clinicians are skilled and have accreditations in those various areas, but by having that network of clinicians, you can assign them to those portals that you've set up, and then patients can then get choice and a much wider choice of clinicians, and you can help match them to the most appropriate person for them. So we find you get better recovery rates, you get better did not attend rates, better engagement, because you're really helping to get that person the right person.
And so I guess through this you'll be getting ratings for each of the clinicians as well. They'll see their ratings just
Yes.
as others. I mean, I have a friend who is a surgeon in the US, and his success rate on, I'm sure you know, it's pretty much determined by the insurance companies, but he was so good at doing knees, and then he was so good at his success rates on right knees, he became the right knee guy. So he just does right knees. Is there something similar to that that you'll be able to determine with the clinicians?
Well, as I say, whether you've got the data, right, and the AI, obviously clinicians might want some variety, and that's part of what they want, so fine. But you can obviously assess what recovery rates are for what type of person, for what type of problem that they have, and you can start to sort of to work out that. Obviously, we're assessing recovery rates, customer satisfaction all the time, and therefore, you've got to do that. Sort of some of the metrics like recovery rates, you have to base it on the severity of the problem as well. So you're not just because some people that might be way more severe might not have the chance to recover. So constantly assessing that of the therapist. We haven't yet put the sort of trust pilot thing for individual therapists yet, because I don't know if that was very fair in mental health. But yeah, we're constantly assessing.
I was wondering whether there was a way from your ability to measure the outcomes.
Yes.
To be able to determine it rather than a trust pilot, because that's a subjective piece, whereas you seem to have the roots to get the actual data to make that decision. So I guess at the moment you've not got, you will always have an undersupply of clinicians, or you won't have enough to cover the demand that you have. But you could, do you ever have a situation where a clinician has offered you up X hours and you've only used 80% of that? Or?
Yeah, I mean, so capacity planning is obviously the biggest thing. Now, we pride ourselves on not having a waiting list, because if people come to us, we don't want to shift a waiting list from one place to another. Yeah. So we take what we can manage. Occasionally, obviously, if a slot's in a place, the occasional slot may not be filled, but that's a constant battle to ensure that happens. And again, as the technology improves, AI improves, etc., you can get better at capacity planning, I think. And your point before is, the data, I think, is very important, and you can collect a lot of information, demographic information, etc., to help again provide a match of the right clinician to that human being. So I think that's
because I was just thinking the other way around. You could end up in a situation where you are asking Dr. X to give you another 20 hours because you know that you have a demand for that number of people, and so you're making the call rather than the doctor saying, "Oh, I've got 20 hours," or
Well, you have. I mean, you can only do what that clinician can do, right? So, but it's
if you can let
planning.
them know that actually they're really good at this thing, they can help X number of other people. Going back to the ethical piece, if they were aware that actually this is something I do well, and I can help even more folk.
No,
they might give you more of their time rather than watching Coronation Street or something else.
Well, yeah, absolutely. Like based on the on what they can do, absolutely. In terms of you've got to be careful you don't burn them out, right?
No, absolutely. But you'll be able to keep a track of that as well.
100%.
And I guess you'll have enough knowledge, experience, and data around burnout.
100%. Yeah.
As well, and you maybe even build that into the deployment model that you've got.
Yeah, no, absolutely. And again, by having a tech-first solution that can measure all this and do, this is what I think is interesting and exciting for the future.
I think that's actually excellent in terms of the ability that you'll have, both in terms of managing the customer base and the doctors, and even optimizing where they're actually deployed as well.
Exactly. Yeah.
Brilliant. Well, thank you very much, Julian.
Thank you for having me.
Dr. Julian. And for, it sounds like a brilliant business, and every success for the future.
Thank you. Thank you very much for having me.
Thank you for joining us on this episode of Founder Metrics. Remember, even the biggest of ambitions are within your reach when you leverage the right strategies and metrics. If you enjoyed this episode, be sure to subscribe and never miss a future episode. You can visit vested.com, Founder Metrics, for additional resources, articles, and exclusive content. Join our growing community of entrepreneurs and founders by following us on LinkedIn or X. We'd love to hear your thoughts. Together, let's continue to unlock the metrics of success, sharing, and create a brighter future.